that around 30 million men in the United States alone are affected by erectile dysfunction. Shockingly, this common condition becomes even more prevalent with age, with over 40% of men aged over 60 experiencing erectile dysfunction. Despite these startling statistics, erectile dysfunction remains a taboo topic that's often surrounded by shame and misinformation. So in this episode, we are going to confront the reality of erectile dysfunction head-on, exploring its causes, treatments, myths, and facts that surround it. Let's get started. Now, whilst ED primarily affects men, it can also have a significant impact on their female partners as well. Women who have a partner with ED may feel frustrated, confused, or even blame themselves for their partner's difficulties. They may also feel unsure of how to support their partner and maintain intimacy in their own relationship. Hence, I encourage women to listen to this episode as well to gain a better understanding of what their partner may be going through and how they can offer support. Let's start with the definition. Erectile dysfunction is a medical condition in which a man has difficulty achieving or maintaining an erection during sexual activity. This condition can be caused by a variety of physical or psychological factors and can have a significant impact on a man's sexual health, relationships, and overall quality of life. So what causes ED? Well, there are many factors that can contribute towards this condition. Physical causes can include health problems such as diabetes, heart disease, high blood pressure, obesity, and neurological disorders. Certain medications such as beta blockers, antidepressants such as SSRIs, and certain form of chemotherapy may also contribute towards it. Other culprits may include alcohol, tobacco use, and illicit drug use. In addition, psychological factors such as stress, anxiety, depression, and relationship problems can also play a key role in this condition. Let's look into these psychological factors in a bit more detail. Number one is stress. When you're under stress, your body releases a hormone called cortisol, which can cause your blood vessels to constrict and reduce blood flow to the penis. This can make it harder to achieve or maintain an erection. Number two, anxiety. Anxiety can cause physical symptoms such as increased heart rate, sweating, and muscle tension, which can interfere with sexual arousal and function. Number three, depression. Depression can affect your mood, energy level, and interest in sex. And number four, relationship problems. If you're experiencing conflicts or communication issues with your partner, this can lead to stress and anxiety, which can in turn contribute towards ED. It's important to note that psychological factors can often coexist with physical causes of ED, such as diabetes or cardiovascular diseases. Now, apart from the physical and psychological factors, there may be a third cause as well: pornography. There is some evidence to suggest that excessive consumption of pornography may contribute towards ED in some men. One theory is that frequent exposure to pornography can lead to desensitization, which can make it harder for a man to become aroused in real-life sexual situations. However, more research is needed to fully understand this relationship, and it's important to note that not all men who consume pornography will experience ED. Now, let's talk about some treatment options. There are several ways to treat ED, including medication, therapy, and lifestyle changes. Number one is medication. Medications such as sildenafil, also known as Viagra, tadalafil, also known as Cialis, and vardenafil, also known as Levitra, are commonly used to treat ED. These medications work by increasing the blood flow to the penis, hence allowing for an erection. These drugs come in different strengths Hence, it's important to consult with a doctor to check what would be the right dose for you. Number 2 is therapy. Therapy like cognitive behavioral therapy, also known as CBT, can be effective in treating erectile dysfunction. Specifically, that has a psychological component attached to it. CBT aims to help patients identify and change negative thought patterns and behaviors that may be contributing towards ED. And number 3 are lifestyle changes. Lifestyle changes such as exercising regularly, eating a healthy diet, and quitting smoking can also improve ED symptoms. Finally, let's talk about some myths surrounding ED that may prevent men from seeking help in the first place and suffer in silence. The first myth is that ED is a normal part of aging and that there is nothing that can be done to treat it. Whilst ED is more common in older men, it is not an inevitable part of aging, and there are many effective treatment options available as discussed above. Myth number 2 is that only older men experience ED. However, as mentioned earlier, ED can affect men of all ages. And the third myth is that ED means that a man is not attracted to his partner. ED has nothing to do with a man's attraction to his partner. It is a physical or psychological issue that can affect any man regardless of his sexual orientation or relationship status. So to conclude today's episode, ED is a common condition that affects millions of men worldwide. While it can be caused by a variety of physical and psychological factors, there are many effective treatment options available. It's important for men to seek help if they are experiencing ED and to remember that this condition is not a normal part of aging.
Thanks for tuning in, everyone. Please like and share this video and subscribe to our channel. Together, let's build a world where sex education is a human right.